So can you go ahead and introduce yourself?
Yeah, I'm Andrew Papendieck. I guess Dr. Andrew Papendieck. And I am a family medicine physician resident at Brackenridge University Hospital.
Nice. So what do you do as a family practitioner?
Well, family practice is a unique field in that it's clinically oriented, and we have the privilege of getting to know our patients on a personal basis and following them from birth all the way through their elderly ages. So
is that why
clinically based?
So is that why you chose that field? Because you kind of get to deal with all ages, or what interested you about that field?
Yeah, that's definitely part of the reason. And another big portion of the reason is that family medicine, as I said, is a unique field that allows you to make a personal connection and actually have extra time to set aside in clinic or craft your own clinic schedule so that you can emphasize certain portions of what you're interested in medicine. And for me, it's the personal connection with my patients. And I think that family medicine accommodates that more so than some of the other fields.
Nice. So I know you said one of your interests was like medication and like genetics and how it's going to be revolutionized. So how do you think that that's actually going to happen in the next few years, or how it's happening now?
That's a great question. I mean, it already is happening. Genetics, as it applies to medicine, is limited currently in a practical sense, but the potential for genetics to be applied to medicine is hugely expansive. Personally, practicing medicine, I've applied genetics very little up until this point because it's still very costly, and we still don't have the research that shows their clinical utility in the long run. But one example of what medicine is gearing towards in pertinence to genetics is, for example, we have genes that control how we metabolize different drugs. And one particular drug, we have a good understanding of its metabolites. Clopidogrel, which is an antiplatelet agent. And it's given to patients after they have a heart attack to prevent clotting of the blood. And we know that some patients are very poor metabolizers of clopidogrel. And in those patients, the benefit from clopidogrel is little to none. And we know that antiplatelets actually lengthen life of people after heart attacks. And so if we can test for this gene and find out that the patient is a poor metabolizer of clopidogrel, the most often used drug, then we can switch them to a different drug and actually extend their life based on the alleles of a particular gene.
Right. So we're actually like learning about metabolites in our class, right? We recently talked about it. So do you feel that your education, whether in med school or undergrad, do you feel that it really prepared you for this field or your interest in genetics?
Mm-hmm. Definitely. We as human beings unfortunately most of us can't retain everything and regurgitate it or apply it on a as needed basis. We need to constantly refresh ourselves on the things that we need to remain familiar with. So a lot of the things that I learned in undergraduate school have gone out of immediate memory. But I feel confident that everything that I learned in my general biology course when I was a freshman in undergraduate school has been incorporated into my neurocognition and my understanding of basics of science and medicine.
Right. So for genetic modification, as far as genetics go, like I know you said the technology is expensive, but it's definitely getting more advanced. Do you think people's fears are kind of valid when they say, oh, with genetic modification, like something could go wrong, it's going to backfire on us? Do you think that's a valid fear, or do you think it's all for the good of the great society?
It's definitely a valid fear. All the movies that we see about cloning and, this great crazy movies that seem very out there, development of, mass populations of humans that are cloned based upon another human being's genetics. It's all very scary to think about, and it's really not that far from where we are with our understanding of genetics and creating life or understanding life as it originates. But we are cautious, and we need to continue to be very cautious and continue to evaluate on a moral and ethical basis if what we're doing on a basic science level and further up is more morally and ethically right.
Of course. So in your experience, what advice can you give to future pre-med students or someone who's considering going into your field or just study any type of research in genetics?
Well, it is a field that has huge potential to play a giant role in our health and our movement in the future of medicine. And so it's a field that will explode without a doubt in the next 5, 10, 15 years. And it will have more and more, exponentially more and more applicability to medicine and all fields of science. So if you are interested, it's a great field to be interested in for purpose of job opportunities, and if you're interested in science, I think it's immensely interesting. For students that are interested in medicine, whether or not it applies to genetics, I think medicine is a wonderful, wonderful field. It allows a feeling of importance, and I just can't imagine feeling as good about doing any other job. Of course, I'm biased. But I would advise anyone interested in medicine to be sure of what it is that is motivating them, and be clear on what the requirements of medicine are and how taxing it can be on your life, and have a firm sense of commitment before you move forward with medicine, because it is a very challenging field initially to get involved in.
Nice, awesome.